Medicare spent up to $5.8 billion on medical services with little to no clinical benefit. Well, that is not my number. That is the Medicare Payment Advisory Commission. January 2026, Medicare is testing something new. Artificial intelligence will help review certain medical services before you receive them. The program is called WISeR, which stands for Wasteful and Inappropriate Service Reduction. So if you have original Medicare in one of the 6 states, this affects you. If you have Medicare Advantage, it does not. Hi, I'm Hanh Brown. This is where AI, policy, and aging collide, and where your family fits into all of it. So in this video, I'll explain exactly what WISeR is, which states are affected, and what protections are built in, and what stays the same about your Medicare coverage. So WISeR is not a hypothetical future. It launches 2026 January. Up to $5.8 billion, and that's just Medicare. Across all healthcare, up to 25% of spending goes to services that do not improve outcomes. So that's a problem this program is trying to solve. You see, more than 80% of health insurers already use AI or plan to use AI in their workflows. That comes from the 2025 survey by the National Association of Insurance Commissioners. Medicare Advantage plans have used prior authorization for years. So now the Centers of Medicare and Medicaid Services is testing a version for original Medicare, the traditional Medicare that tens of millions of Americans rely on. So if you are in Arizona, New Jersey, Ohio, Oklahoma, Texas, or Washington, and you have original Medicare, certain procedures will now go through the AI-assisted review before Medicare pays for them. Now, if you are helping a parent navigate Medicare, this is the kind of information they need starting January 2026. The protections built into this program come later in this video. But first, you need to understand exactly what WISeR is and what it is not. So WISeR, it stands for Wasteful and Inappropriate Service Reduction. It comes from the Center of Medicare and Medicaid Innovation, the same CMS office that tests new payment models before rolling them out nationally. So this is a 6-year pilot program, launches January 2026 and runs through December 31st, 2031. There are 6 states, specific procedures only. So CMS selected technology companies with experience in prior authorization. So those companies will use AI and machine learning to review whether certain services meet Medicare's existing coverage requirements. The key word is existing. You see, WISeR does not create new coverage rules. It uses technology to enforce the rules that already exist. That distinction matters, and I'll explain why in a moment. CMS published 4 goals for this program. So goal number 1, focus healthcare spending on services that actually improve patient well-being. Goal number 2, apply prior authorization processes that may be faster, easier, and more accurate than current methods. Goal number 3, increase transparency of existing Medicare coverage policy. Goal number 4, de-incentivize medically unnecessary care. Notice what's missing. There is no goal to reduce access to care. There is no goal to deny more claims. The stated purpose is to catch services that should not have been approved in the first place. And here's something important. Your doctor has a choice in how this works. 2 options: prior authorization. Your doctor submits documentation before the procedure. Review happens upfront. Or post-payment review, your doctor skips prior authorization. You get the service, Medicare reviews after. Either way, you receive the care. Well, the question is when the review happens. So why does this matter to you? Well, providers who are confident in their documentation may choose post-payment review to avoid delays. Others may prefer the certainty of prior authorization. Which procedures are affected? Well, CMS selected 17 categories of services. Examples include skin and tissue substitutes, electrical nerve stimulators, a knee arthroscopy, and osteoarthritis. The full list of procedures is the subject of the next video in this series. You see, these are outpatient services. They are not emergency care. They are not inpatient hospital stays. They are specific procedures that CMS identified as having a history of overuse or fraud. So this sounds like Medicare Advantage prior authorization. Well, that comparison is inevitable, and it's the source of the most concerns about WISeR, and that stands for Wasteful and Inappropriate Service Reduction Program. You see, Medicare Advantage plans have faced lawsuits, federal investigations, and congressional hearings over AI-driven claim denials. Patients and physicians have reported delayed cares, inappropriate denials, and administrative burden. So is WISeR the same thing coming to original Medicare? Well, there are structural differences. Whether those differences matter in practice is something CMS will measure over the next 6 years. Well, here's what stays the same under WISeR, and this is very critical. WISeR does not change what Medicare covers. If a service was covered yesterday, it is covered under WISeR. The coverage criteria are identical. So WISeR does not change what Medicare pays. Reimbursement rates to providers stay the same. WISeR does not change your choice of provider. You keep the freedom and see any doctor or supplier who accepts original Medicare. What changes is the timing of the review. Instead of Medicare reviewing the claim after you receive the service, certain services will be reviewed before or during the prepayment period. So who is watching the companies that run these reviews? Well, CMS published 3 categories of performance measures. The companies running WISeR reviews will be evaluated on process quality, how accurate are the decisions, and how many claims are they handling. They will be evaluated on provider and beneficiary experience, are reviews completed on time, and are communications clear, and they will be evaluated on clinical quality outcomes. Is care actually improving? So this is not a system where CMS hands off reviews and walks away. These companies have measurable accountability. So now, the exclusions. Emergency services are excluded. If you need emergency care, WISeR does not apply. Inpatient-only services are excluded. If you are admitted to the hospital, WISeR does not apply. Services that would pose substantial risk if delayed are excluded. So CMS built this guardrail into the program design. So if you are planning ahead for a parent's care or your own, these exclusions matter. The procedures under WISeR review are elective outpatient services, not urgent or emergency care. So 2 questions remain. Who decides, and where does this apply? Well, AI assists the review. Humans make the final call. So that is a CMS requirement. Every recommendation for non-payment must be determined by a licensed clinician. The AI flags potential issues. A human reviews your documentation and makes a coverage decision. So this is not a system where an algorithm denies your care and no human ever looks at it. That's the CMS position. Now, whether it holds in practice across millions of claims is what the pilot will test. 6 states, Arizona, New Jersey, Ohio, Oklahoma, Texas, Washington. So if you have original Medicare and live in one of these states, WISeR applies to these selected procedures starting January 2026. And if you have Medicare Advantage anywhere, WISeR does not affect you. So Medicare Advantage plans already have their own prior authorization processes. But if you have original Medicare in any other state, WISeR does not affect you, at least not yet. CMS may expand the program based on the results. So are you in one of the 6 states? Drop your state in the comments. Your existing appeal rights remain in place. If a service is non-affirmed under WISeR, you can appeal through the standard Medicare appeals process. That process has not changed. So January 26th, that's when it starts. You now know what WISeR is. It's a 6-year pilot testing AI-assisted prior authorization for specific outpatient services in 6 states. You now know what stays the same: coverage, payment, provider choice. You also know what it excludes: emergencies, inpatient care, time-sensitive services. So you know who decides. Well, licensed clinicians, not AI alone. You know your doctor has options: prior authorization before a service or post-payment review after. The question WISeR does not answer, and that's what CMS will spend 6 years evaluating, is whether the process actually reduces waste without reducing access to care. And that's a tension at the center of this program. So do you support Medicare using AI this way? Put yes or no in the comments. Now, if sorting through Medicare rules feels like a second job, I understand. I'm building Medicare Brain. It's a tool that answers your Medicare questions instantly. Plain English, no hallucinations. Every answer comes with a receipt, an exact CMS page or regulation so you can verify if need be. So if you want early access, drop Medicare Brain in the comments. So the next video covers 17 procedures under WISeR review and how to know if your planned care is on the list. So subscribe, you don't want to miss it.